Suicide is the 10th most common cause of death in America, with 121 suicides every day. The American Foundation for Suicide Prevention in Western Massachusetts and Northern Connecticut is working to reverse that trend. Carolee McGrath spoke with Foundation Associate Director Heather White to learn more about those efforts to save lives.
The American Foundation for Suicide Prevention, our mission is to save lives and bring hope to those affected by suicide, but our bold goal is to reduce the rate of suicide by 20% by 2025. And right now, suicide is the only leading cause of death that's on the rise. So first we have to stem that tide and then bring those numbers down by 20%.
Why would you say it's on the rise? What's happening?
Well, a lot of it does have to do with the better reporting that we have. We work closely with the National Violent Death Reporting System. They are doing a better job of recording people as taking their own lives, but also because it's one of the leading causes of death that doesn't have any federal funding right now at nearly the level that the other leading causes of death have. And we've noticed a direct correlation between the amount of federal funding in bringing down those death rates, and we're just not seeing that type of support and education around suicide.
Do you think there are a lot more pressures today than there were maybe 20 years ago?
There definitely are, but we're hoping that those get balanced out also by a new understanding of the need for mental health care and that suicide is preventable.
So tell us a little bit of how you became involved in this cause.
Yeah, a few years ago, after the birth of my first daughter, I nearly lost my own life to postpartum depression. And it really made us realize, as my close-knit family at that point and our pastor and our primary care physician, that this can happen to anyone. And even when it comes to postpartum depression, whoever looks like the most successful mom out there, juggling everything beautifully and so happy to be a mom, when they get home, it might not be the case. So it really sort of blew the doors off of this sort of secret society that we didn't think we would ever be a part of. And it hit home for us that this could truly happen to anyone.
And how do you help families who are going through that? I mean, you have those who are just completely heartbroken and destroyed because a family member has committed suicide. How do you reach out to them? Because there is a stigma attached to it, right, no matter what anybody says. How do you help them through that time?
We have a lot of different ways that we support local families after they've had a sudden loss, but the biggest is that we try to involve loss survivors in all of the work that we do at the foundation.
So what are the signs for people to look at? Because, sometimes, you think somebody has it all together, yeah, and you're really missing those cues.
Right, and the signs do vary through different age brackets and different age groups, but primarily you want to listen to their talk, their mood, and their behavior. So if they start saying things like, I just don't want to do this anymore, I don't want to live anymore, sometimes they can be as obvious as that, or sometimes they can be more subtle, just, I'm tired of being a burden to you. So often people think it's selfish to take their own lives, and how could you do that to your family? But they truly do feel like a burden with all of their problems and their troubles that they have, that they feel like they're lightening this burden for their family by taking their lives. So things like that. Behavior, especially with younger children or teens, you'll see them giving away some of their prized possessions. That could be a warning flag. Excessive drinking, isolation, and then their mood. A lot of us would think, depression, but also if you're seeing some impulsivity, and that can also be a protective factor. If you're not a very impulsive person, that could be one of the things that keeps you safe.
And tell us a little bit about this problem among teenagers and children.
Yes, right now what most people would be floored to learn, I think, really, is that suicide is the second leading cause of death in children ages 10 to 14, behind only accidents. And for teenagers up until that 24-year-old age group, we're looking at the third leading cause of death, also second only to accidents. And things like childhood cancer, your child today is 4 times more likely to take their own life than to die by childhood cancer or leukemia, but childhood mental health is just not getting the care and the attention, and it's not a priority that it needs to be to keep our kids safe.
And what about, teenagers who are in a situation where they've had a family member who've committed suicide? Is that a common scenario?
We will say that once you've been exposed to a suicide in your personal life, your risk factors do increase greatly. Again, you want to look at that body of intersecting risk factors, and then we all also have our own protective factors, which is something that I like to focus on also, is what are our protective factors that we have in our lives. But once you have lost someone, it does increase your risk, which is why we do unfortunately see sometimes multiple suicides within a family, because if you think about it, they all have that shared genetic mental health history. They might all have that similar childhood trauma or that drinking in the family or the addictive behavior within that family. So when you take that larger picture into account, it almost makes sense that there could be multiple suicides within the same family.
But the bottom line, I think, is what you're telling us, is that there is hope for either somebody struggling with those thoughts or for families out there who've lost someone.
Yes, suicide is a complex health issue, but it is preventable. If we learn the signs, if we learn how to reach out and how to communicate with someone successfully that is in a suicidal state. And the other important thing to keep in mind is when someone takes their own life, they've reached an absolute crisis point. And on average, that crisis moment only lasts about 8 to 20 minutes. So if we can truly keep someone safe for that 8 to 20 minutes through things like limiting access to lethal means, or having 1-800-273-TALK on your cell phone, so if you encounter someone, you can call that line with them, the crisis line, or other ways that we can keep them safe in that 8 to 20 minutes, we can get them through that crisis point. Your body can only continue that agitated state for so long before it naturally comes down from that, and then we can move them into some long-term help and care. So we really need to keep those people safe during that crisis point, and then look at what's going on in their lives and any warning signs they might have been sending to us that we didn't notice.
All right, Heather White, thank you so much for talking about this subject that a lot of people don't want to think about, let alone talk about. Thank you.
And what we say is talk saves lives. You won't put the idea into someone's head if they aren't already thinking about it. So be direct. If you're worried about someone, let them know, and don't assume that someone else is going to help them.
All right, Heather White, thank you so much.
Thank you.